I was on my way home from work that afternoon and turning onto my street. And my phone rang. And it was Dr. Howell. Fortunately, when I got home, my husband was there, and we just put the phone on speakerphone and sent the kids out of the room for a little while so that we could hear what was going on and try to absorb it and take lots of notes and make sense of it.
It's taboo to utter the word cancer in Greek, and so we call it tokako, which means the bad thing. And it's almost like a superstitious thing that if you don't say it, you won't have it. I noticed a mole on my body that seems new, but as someone who's Greek with more olive skin, I'm pretty moly. I probably have like more than 200 on my body. So it didn't feel weird that there was maybe a new one there. I went to the dermatologist and had it removed the day before I left for a family trip to Greece. 2 weeks later, I get home and my dermatologist calls me to say that it could be potentially fatal, and it was stage 3 or 4 melanoma, and she was referring me to an oncologist.
My son Simon was diagnosed at age 9 with pediatric melanoma. He had a wide excision, he had the sentinel lymph node biopsy. Follow up with that, he did have his lymph nodes removed in his left armpit. It's a painful process. It was a very painful process for him.
When I was 9, I didn't really understand how serious cancer was, and I didn't understand how serious of a threat it was. And if I was diagnosed today when I'm 14, it would scare me a lot, and I'd fear for my life. But then I was just like, oh, I'm just gonna go to the hospital, it'll be fine. And I think almost not knowing the gravity of the situation helped me get through it.
So as a mom, seeing your child, anybody you love, in that much pain and concern and confusion is really tough.
Walking into the cancer center, it's really tough because you're hit with what's going on, and especially in the beginning stages when prior to surgery, when you're prepping, the mole had been removed, but I was told I had to get more of the site removed, and I had to get the closest lymph nodes removed as well. That was really difficult, just trying to understand what that meant, and also wondering if there was a tumor in my body or I had more cancer. I did have one nurse tell me, if you had been here 10 years ago, we would tell you to get your affairs in order.
As a medical oncologist, the primary focus of my practice is on patients with advanced or metastatic disease. So that could include patients who are at high risk after surgery for their cancer coming back, or potentially patients whose cancers can't be removed surgically. We're presented with challenges almost every week in clinic. And I think part of me as an oncologist, what hits the hardest is when we see these young patients dealing with advanced disease, incurable disease, and how do you have that conversation? How do you have the conversation with patients, in some cases, who you're talking about trying to get to go to their junior prom, knowing that that's going to be probably one of the last big special events of their life? How do you talk to patients about wanting to see their child go to kindergarten? That these are patients in their 20s and 30s, where we talk about that may not be a reality, and that's unfortunately still all too common.
Talking to Tracy over the phone, she was just there for me by text or phone whenever I needed her, and it felt really comforting to know that this woman knew her research, and I felt like I could ask her questions and she wouldn't be giving me like a dramatic interpretation of how she felt I should be feeling. Like, she could back it up with like her research and experience in a really empathetic way, and so I really value her work and her presence for me throughout this whole thing.
I can't stress enough the importance of the work that Tracy and Polka Dot Mama does. I think it's so key to focus on prevention because the majority of melanomas are preventable. They are curable when they are diagnosed at an early stage. And in the medical oncology world, so much of the focus is on drug discovery and drug therapy and new targets. And that's true, that's important. But when we really look at melanoma patients, I would really love it if no one ever had to come see me, if we could catch everything early and we could prevent these from ever occurring in the first place.
Melanoma doesn't affect just the person who has it. Melanoma affects the whole family.